Hey, this is Dr. Renicky with CellGen Regenerative Medicine in Savannah, Georgia. So, of course, a very simple common question people ask often enough is, does regenerative medicine work? And I can say it certainly did for me. In fact, the whole reason that we decided to open a regenerative medicine practice is because of the pretty dramatic and amazing turnaround it made for me with my own knee problem. So almost 20 years ago now, I was in a motorcycle accident and I came down on my left knee. Not all that terribly hard, but I just hit it at just the right angle that I dislocated the knee. I tore the main ligament in there, the ACL or anterior cruciate ligament. And I talked with plenty of people that had had the surgery to have that repaired, and it seemed a real 50-50 split on whether they were better for having had that surgery or whether they were worse for having had that surgery. So I opted not to do it. And over 20 years, my knee did pretty well. I had it adjusted by my chiropractor quite regularly. And I just started noticing in the last several years that it was giving me more and more difficulty. And I was still able to walk fine most of the time, but kneeling down had become very difficult. Squatting had become very difficult. And I was having pain more and more often with it and having to spend more and more time icing the knee and doing things like that. And a friend and a colleague had suggested that I might consider trying a stem cell injection into the knee. And I decided that it made sense. And so I did. And it was really unbelievable how fast the turnaround was for me there. I think it was only 2 days later that I had forgotten all about the things they told me about don't go out and do anything too physical and take it easy and so on. And I was working on something in the yard. There was just a project that had to get done and I was doing it. And at some point I stopped and realized that, man, my knee would probably be killing me with this right now. Why isn't it bothering me? And I go, oh yeah, because I just had that stem cell injection. And that was about the last time that I can remember that I really had any trouble with my knee. It's been over a year at this point, and still the knee feels strong. It feels much healthier. I have little to no pain in it ever. If I get down and kneel to do a whole bunch of tile work, I'll eventually probably have some trouble in that knee, but I'm gonna have trouble in the other knee that I didn't injure or damage after that amount of time kneeling on a hard tile floor as well. But in normal day-to-day life, it's been a massive turnaround. And I'm able to do quite a bit more now than I was able to before. And so when we opened our regenerative medicine practice, the very first patient that we had come in the door was a 91-year-old lady. And she came in with a cane and she was telling us that she was not a candidate for a knee replacement because of her age, that they had talked about wanting to do it once upon a time, but now they said that she was too old to do it. Even though she was bone on bone, she was just kind of told this is what you'll have to live with and you'll just have to learn how to deal with this pain. And so she decided to go the regenerative medicine route and she got stem cell injections in both knees. 6 weeks later, we saw her for a follow-up and she talked about what an amazing reduction there had been in pain level. A week later, she comes back in just super excited and happy because it just keeps getting better. She stopped in literally just to tell us that her pain level keeps getting better and better. And then we've seen her now at her 12-week follow-up, and she said that she feels like she's almost ready to just put down the cane, that it's only really there now just as a like a comfort issue rather than feeling like she actually needs it. And she's back to being able to walk through the entire Walmart. That was like her thing. And remember, she's 91 years old. There's not a lot to keep her mind occupied. So what she would do is she'd need one thing from the store. She'd go to Walmart to get it, but instead of going in and get that one thing, she'd walk every aisle up and down, see everything there was to see in Walmart, spend a few hours there doing that, but her knees had gotten so bad that she wasn't able to do that anymore. She had to go in and get that one thing, get out, and get back to where she could sit down. But now she's back to going to Walmart, and it's a several-hour trip every time she goes again, and she's walking every aisle and seeing everything and touching everything and trying to keep her body moving and her mind engaged. And it's really been a pretty amazing thing for her. So we got many, many cases like that. And I would say that yes, stem cells work, regenerative medicine works. But like with anything else, you got to do your research about the facility that you're choosing. There are amazing medical doctors and there are terrible medical doctors. There are great chiropractors and terrible chiropractors. And there are people who get amazing results and people who get little to no results. And it's always about the secret sauce. It's always about the specific combination of how this particular doctor is doing what they do. And so that's no different there in regenerative medicine. You got to make sure that they're using the right type of stem cells and they know when to use stem cells versus PRP and all those kinds of issues. And so I feel like we're doing a really good job with that here at CellGen. And I would encourage you to give us a call. We'd love to see if you're a good candidate for regenerative medicine and what we could do to help you.